All right, that should do better. You guys got to let me know if the volume's not working. All right. You know what? I'm gonna do partial cleavage show here for a minute. I don't know why they don't make these go straight up, but anyways. You know what's weird? I have these cameras set up in the exact same positions every day, and they move somehow. How are you guys doing? Did you miss me? Cheers. We got our little evening espresso time as we dive in. Oh, to the chat. Almost choked and died right in front of you guys. Anyways, hope you guys had a good weekend. I mean, it's Wednesday. I don't know why I'm saying that like it's Monday, but I guess it kind of feels like a Monday. Um, how are you, brother? Doing pretty well. What causes blood and stool only for one time? Okay, it's probably something that either ulceration that happened very quickly from certain foods, especially sharper foods, corn, popcorn, even certain, I mean, you could do certain chips and things like that that are just really sharp. But there can also be, the connection to an inflammatory response over and over, leading to allergic responses, say wheat, say um, certain breads. A lot of grains are going to do this too. And now it just got to a point to where you can't adapt anymore, and you saw some blood in the stool there, and now it's like, oh my goodness, what is going on here? I'm glad it only happened once. That's great. It's great to hear, but there's probably some trigger going on there. And if not, it could have been a one time off thing, but the Kingfish Gamer says, wait a minute. I guess we'll wait until who am I? It's in the bot. What? You know who I am. It's in the title of the stream. For crying out loud. B&V is liking it up like crazy. I wonder if I know this person. Thank you very much. But either way, what are you a doctor of? So I'm a chiropractor as well as a health restoration practitioner for the Wellness Way. Currently opening up a spot here in New Jersey, which will be ready in about 1 to 2 months. But until then, I'm pretty much giving out all the advice I have for no barrier at all. Doing that through emails and phone calls and developing a game plan to get people's food, lifestyle, and supplementation down pat. So basically, in an all natural health sense, running labs, taking x rays, getting people to reduce physical stress. That's really where the chiro portion comes in physically. And then you have more of the wellness or health aspect of things through lab testing, getting mental stress down, working on chemical exposure to things that can go on your body, in your body, water quality, air quality, all those things. So, but yes, all natural stuff. Yeah. For some reason, this. Hello, how we doing, Doc? I got back pain. Okay, wait. I have pain in the back and also in your chin. Really? Is this possible to get a heart attack? I mean, you would see some other some other issues get thrown off. Your blood pressure would be one of them, heart rate as well, and then you would have some stereotypical, and not all the time, but there is a typical pattern of pain down the left arm and things like that. impending doom, which you know, in the moment you're like the worst anxiety imaginable. But I would say that can also be a visceral nerve irritation response, which I see a lot. Um, there are areas of the spine that respond to visceral organs, and that's how these organs get innervation in the first place. It's from the brain that travels down the spine. Body keeps everything most important in the middle, and then those nerve roots exit from the spine, innervate the organs, and basically communicate a whole ton of stuff there. But the immune response is also involved. Um, but I'd be curious of a couple more questions. I mean, you can't rule it out from just those two things, but mm, frick, spilling stuff all over. Can you speak about Arch or what? Sebastian Urbano. It's been a while, my man, since King's days. That's freaking awesome. So, Suzanne's back. How we doing? I hope you're doing well, Sebastian. It's been a minute. It's been a minute, brother. I got fibromyalgia. Oh, Jacinta? I didn't see your message here. So let's tackle this one. I got fibromyalgia and anxiety. No fun. Not fun at all. Getting off Ox. They put me on LDN. How do I calm down with? And then it looks like it cut off your message, but we got enough that we can work with. So, fibromyalgia, literally muscle fiber pain. We want to figure out why you're having that pain because you can not even twist your ankle. You can just twist a doorknob the wrong way, and now your wrist hurts for 2 weeks. That's very real. I've seen plenty of people with that, but it is largely based around histamine responses. So, how inflamed the body is, where those sources are coming from, because food is a huge aspect of this. And then there's also smaller, more repetitive or frequent chemical stressors like poor air quality being one of them, leading to things, possibly even mold in the home or mold in the bathroom, stuff like this, that's going to suppress the immune response and neurologically send you into crazy town. I'm not saying that mold is like the number one thing that you're dealing with, but that could be a piece of it. And the GI has a ton to do with this as well because it's a huge place to look for those sources of inflammatory issues. But I would want to see the blood work and labs that you've had run already. I would want to know what the game plan is to start getting to the root of these things. But that is really what you want to do is identify the stressors and the causal factors of what's going on here. And now you can start to develop a plan to get those back to normal. Um, Albizia works really well with just getting that inflammatory response down. California poppy, an extremely safe thing to do, even with what you're doing currently right now, that won't interact with anything, and it's just like walking on a cloud. So, okay, wait, withdrawal from the oxy. Okay, that's a little trickier. Um, that's a little bit trickier. Maybe Suzanne would be a good person to turn to here because that's more of a med situation there because it has to be managed in a certain way coming off those things. Like cold turkey is definitely going to beat you up there. And I wouldn't want to do anything that would promote such a sedative or relaxative or a relaxation response that could actually throw you back to wanting those types of things. So for right now, I would just say stick with the Albizia, stick with something like California Poppy. It's gonna be very light, very stress free, and send me a message on here too because I want to see some of those labs. Sorry if that was a long answer here, but Carlos, hello, bro. Can I get a follow? I will do it after this, I guess. That's the first time someone's asked that, actually. Okay, doke. Do. Good to see you doing your thing. All love. Heck yeah, man. Heck yeah. Okay, back to the YouTube chats. Let's see what these goons are up to. It's always interesting here. Happy Wednesday. Happy Wednesday to you. For the past 3 days, if I put my head on a pillow, it feels like I'm lifting my weight. I can feel the weight of my head. Okay, so some irritation and things there. You can do I mean, hydration, getting sugars down, doing something like Albizia there too. That's why I talked about Albizia. Camera's over here. What the heck am I doing? I'm looking at the chats here. Albizia is great for issues with the head and getting headaches to calm down because it's going to be more of a diuretic in that sense. But again, working on histamine, and maybe you're catching a cold or something, so you could possibly do something like reishi mushroom, which also has some benefits to headaches and things like that. But again, we want to identify why this is happening in the first place. But that could at least get you over the hump, something to start with, and probably doing a simple piece of blood work, see where the immune system's at, maybe even doing some of the innate and adaptive immune cells, which is pretty much a more fancy way of doing things, but the immune system's huge, as well as the nervous system responses too. But I would want to start exploring there. Sometimes my heart runs faster than I can control it, so that could be ish simple potassium deficiency there. Really common to see, and honestly common in athletes and things. So I would want to ask about activity and stuff. If that's really high, you may be deficient in that, or there can be issues with the stomach itself, and now creating some issues there too. But um, in the off chance that you can have like a postural issue to where people are changing postures, I mean, typically it's gonna be like POTS or something. And Suzanne says POTS. How'd she know? Vagal nerve dysfunction. She's right along with it. That's where you can kind of retrain some of this with an inversion table, going to Cairo, getting massage therapy done, or even somebody with like an SOT type of technique that can work on the cranium, the cervical spine, helping your body get into a parasympathetic state. So, if the potassium doesn't budge things, I would do something like chamomile to where you can um, do things like that too. Okay, wait. TikTok is going buck wild. So let's get back to these as the YouTube ones build up a little bit. Okay, Jancita, trauma. And trauma in the sense of the physical things that go on in the philosophy here is mental, chemical, physical stress or thoughts, toxins, trauma with just the chiropractic philosophy that we have here. So the trauma in that sense is physical, but there is mental stress that totally exists. Can Hashimoto's cause heart palpitations? It can, because you're going to see when things are still inflamed and going on, you're going to bounce back and forth from hypo to hyper. So there's probably something inflammatory still taking place. Um, like Suzanne mentioned with the leaky gut, I don't know if that was connected to that comment on there, but that could totally be a piece there. But I would want to start with some blood work, get a good 10,000-foot view of things, and then we can dive into certain paths depending on what that's showing. But yeah, that could totally happen. And if that's where you're at, stick to the inflammatory reducing things, something like turmeric, something like Japanese knotweed. Those are both great things. Um, but yeah, your thyroid's probably picking up a little bit more. So YouTube, let me know how the mic is here too. If I'm sounding too quiet, I like your wristwatch. Thanks. It was like $20 at Walmart. It just makes me look better, and it's actually a righty watch. So for those of you watching, I'm a lefty. If you haven't, I don't know if you guys picked up on that, but I'm a lefty wearing a righty watch. So it's actually supposed to be on this hand, but it gets in the way of things when I write. So, and I hate it. So I don't care. I'm wearing it on this one. Anyways, can I ask a question being related to pre-med? I don't do anything with meds here, so, but you could ask anything, honestly. Withdrawal from Oxy, yes. I got California Poppy, nice, beautiful. I would wonder if that's in liquid form, just for the best formulation of these things. They do need to be in liquid form if you're taking an herbal plant. So, Dr. Brad is on, or Dr. Dressy. Heck yeah, I think I saw that when I was hopping on here. Restore the gut, liver support, meat stock or bone broth. Totally. Hydration, magnesium. Suzanne, we are best friends now. Can we be best friends? I love this lady. I mean, honestly, getting labs done, please, because that gives us a clear direction to start in. And you are kind of guessing if you don't have those labs to go off of, even if it's just baseline simple things that we can start with and branch out from there. So, how can I go about being an MA? I have no idea what that is. Lord Bolt popping in. How we doing? Suzanne says, lol. Yes, totally. Totally. Okay. Where'd we live off here? On the heart palpitation question, wristwatch, Nikki. How you doing, Nikki? Consistent nerve pain on the bottom of my foot, so can be spinal related, can be muscle related, could also be related to sugars, and that leading to a B vitamin deficiency. I am unsure of what to do about my nerve pain in my foot since I got COVID. Interesting. What could I do? So maybe that there's a viral connection there. I haven't seen that a whole lot, but I would say number one, start doing some shaga mushrooms, get an inversion table, start doing some daily foam rolling all up the spine. Um, what else could you do there? And start on some liver glandular or a organ meat tissue that's going to have a ton of B vitamins in there so that you can get all the B vitamin deficiency issue handled. And then with certain proteins from COVID, Shaga has actually been shown to help that. And that came out in like 2020 or 2021 from that research article. So pretty cool. That just jumped back in my head. Um, but yes, those are plenty of things that you could do. Okay, wait. A whole bunch of new chats just loaded. Sorry for you guys are responding a ton on here, so I'm not ignoring them. We're just not there yet. The head on the pillow. Okay, yes. The nerve pain in the foot. Multivitamins, yay or nay? I say nay. Go with an organ meat because they're mainly synthetic. So organ meat, when I mention that, it's usually liver or heart or kidney or something like that. If you don't know where to get them, let me know. I'll point you in a direction. But for the people on the YouTube chats, I have my email in my bio there, and then the people on TikTok just send me a message. I will get back to you guys and build you out a whole plan. We'll get on the phone too. I've been doing that a lot more. Hey Doc, what's the topic? Pretty much up to you guys. Asking questions. Thanks, Nikki. What's relaxing? Do you mean withdrawal? I don't know what we're talking about there. How am I doing? I'm doing pretty well. Pain in the foot. Did I see my yes? Reishi mushroom is a potent mushroom with tons of health benefits. Yes, it is. Totally. I love it. Because of that, my hair starts falling out. Hmm. Multivitamins, where is that the first time you commented on there? I don't know. We had a hair loss question. I don't know what the first part of that was, but anyways. I believe in reishi can be an immune regulator. It's actually an immune modulator, so it can change it up or down, or yeah, regulating things. But modulation is the key term there. Meaning, if the immune system is too weak, okay, yes, that's exactly what you meant. If it's too weak, it can strengthen it. If it's too strong, it can calm things down. Yes, totally. It's just if you're getting medicinal mushrooms, they do need to be grown on wood chips or on dead trees, basically. A lot of brands are doing them on rice blocks, and you actually lose a few of the beneficial compounds. You'll get some of them still, but you do lose a few of them. Okay, back to TikTok. So, pre-med question, MA, medical assistant, nice. Good, very good. Do you think there's a connection between using probiotics and healing something like depression? So it's an adaptation to a lessening of commensal bacteria that in turn leads to less production of the happy neurotransmitters that make us have a good mood or feel motivated or, you know, smile and all those things. There's other factors too, like sunlight and all these other things. But probiotics definitely connected to that. I just don't know if yours are too low or too high. I would want to know something about antibiotic history because that can be really common. You could just have done a ton of antibiotics in the past and and seen that issue, but there can also be some opportunistic infections too that are taking place and sort of taking over the GI environment, and maybe it's low, maybe it's high. This is why I, push people to get labs done because we're guessing unless we know for sure. So there's definitely a connection there. But there's tons of other things that are connected to this too, hormonally, both from a stress point of view and from a estrogen standpoint or a progesterone standpoint or a testosterone standpoint. So it's kind of a mixed bag when it comes to things like that. Nerve pain, soft wave therapy, very good stuff there. Meat stock, liposomal vitamin C, those are good options too. What is liver glandular? It's basically grass fed and finished. You do need to make sure that these are coming from good sources, but grass fed and finished. Beef liver, essentially. You can do chicken liver, you can do other livers and things, but it just needs to be coming from a good source. That probably being your best, most affordable option there. If you're trying to find a good brand, let me know. There's a few out there. Anthony, what's poppin'? Gene, do you know how you get tested for POTS? There are some ways to do it medically, and then there are, um, more functional testing and things like that. But it depends on if you're looking for like a straight up diagnosis, which you can do. You can do things medically there, or you can do things naturally as well. It's just not about a diagnosis in the natural world. It's more of how do we get function back? Where do we lose that functionality that leads to us to have irregular heart rate variability, especially with changing postures and things. So I would look at food allergies. I would look at the GI, and I would get an immune panel done that looks at the innate and adaptive immune cells. So you know where those things are coming from. But potassium also highly like to issues with that as well. What is up with my throat today? It's freaking cutting out like crazy. I can't hit the same speed that I usually hit. Usually it's like we are just rolling off the tongue here. I don't know, guys. It might be coming down with something. I'll get some medicinal mushrooms going for who mentioned the reishi? Loving Dean the God Machine 333. I might be coming down with something. Do some crazy amount of vitamin D after this. I was up until 2 a.m. Oh my goodness, Laura. Not during the sleep challenge. Did you see my question? I did not. What about IIH? I don't know what that is. Lane says, "Hi, you lovely human." What's up, Lane? How you doing? Georgia page. Sorry. Is the bioavailability different between liver glandular and a compounded multivitamin? Yes. Yes. Something like an organ meat is going to be the most bioavailable and nutrient dense food that you can get out there. So, yes, and yes, not only to the bioavailability, but also to how much is actually in there. So, beautiful question. I don't know if you were just setting me up there or what, but okay. POTS. Okay, another POTS mention here. Sometimes does cause fast heart rate. I've had it. I have managed to control mine. It was due to allergies. Interesting. Um, interesting. So yeah, it can totally be toward an inflammatory response. That's something that I'm talking about ad nauseum here. So there is that, but totally can be linked to things like allergies and GI health and really the immune factors overall that change physiology and lead you to adapt a certain way. But ABU, talk, heck yeah, man. Maybe because oh the weight. Okay, back to the head question. I'm feeling things over my head. My hair starts falling. My hair fall starts that to intensify the hair falling out. I don't know if I'm understanding that question, to be honest with you. What are your thoughts about Letting Go Surrender Method by David Hawkins? I very vaguely remember something like that, or seeing a podcast, or reading something about it. I think that's a beautiful train of thought. I love things like personal development there. I love things like little psychology hacks that you can do because our thoughts are troublesome at times. The human brain is just constantly looking for negativity. And I think childhood also has a lot to do with how people develop the certain social needs and decision making and values that people have. Does a lot of that does come from childhood, but yes, totally. I'm, I'll have to check that one out. Okay, back to the question here. Is the bioavail? Okay, we talked about that one. My son has ADHD. Any suggestions? He is 5. I would do pulling away. Actually, just getting a food allergy test done, and then doing something like California Poppy in the short term until you get that food allergy test back and start seeing the results from that. But that's where I would begin. Since he's 5, you don't really need to go too crazy. Interesting. Can you explain the physiology behind that? Like, why is it more bioavailable? Well, it's where it's coming from. A whole food source is obviously going to be way better processed and absorbed inside the body. And it's essentially just freeze dried organ meats. So your body knows how to break all these things down. Heck, it's food. It's food for crying out loud. So it's not a synthetic, lab made vitamin there. So it'll be metabolized differently as well. It's going to have all the cofactors attached to that organ meat. So with all those vitamins, you're having other constituents in there that's attached to it, not just a straight up complex of B vitamins, which is really common to see in, a multivitamin or vitamin A, vitamin C, and those different things. And where it's coming from is a huge piece of that too. A lot of these things come from GMO'd corn, and corn that's just been modified for 100 years at this point, and it's basically completely different than it would have been. But yeah, my 30-year-old daughter had or has PCOS, and her testosterone's elevated, which is really common. Hasn't had a period in over a year. I'm very sorry to hear that. For the Apple user, I would want you to send me a message on here. I'd be curious to what lab she's had done already. But for things like elevated testosterone, really common and very highly connected to an insulin issue, so blood sugar issue. You can do things like Gymnema for just helping with that calm down there, and that's going to affect aromatase. So she's going to be holding on to more testosterone because of that. And you can do something like white peony along with that Gymnema to help with that conversion and the insulin type issue. But if you don't pull away the sugars and identify other inflammatory triggers there too, we're going to be running in circles and you're going to be buying supplements forever. So I would want to take a look at okay, all labs. Beautiful. Send them to me on the, or just send me a message on here. I'll give you my personal email, um, and then we'll build her out a game plan and what to be doing. Especially if she has decent lab work already to go off of, I'm just going to help you right out. We'll dial in the food and things as much as we can without testing on those things. But heck yeah, thanks for the reply. As a nutritionist, I've seen many articles linking probiotics to depression. Heck yeah, totally. That can totally be a link there. I just when there's blanket things, for every human on the planet, can it work? I don't know. I don't want to overpromise things because if it works for people that have the GI issues that are deficient in commensal bacteria, then it's definitely going to help them. But people may not. People may have an overgrowth of commensal bacteria. That's why I was saying that, and that can just create further issues. But probiotics can also clear out some excess things. So it depends on the individual and stomach acid and all these other things too. So Dr. Gates popping in the chat. What's up, my man? Hashimoto's 3 months gluten and dairy free. Beautiful, but I feel horrible. Should I eat gluten and dairy? No, no. Especially if you have autoimmune thyroid issue. Gluten is like the enemy to that stuff. And there can be some metal fillings in the teeth too. There can be mold issues. There can be issues with the GI as well. But let's just kind of back up the train here. Keep avoiding the gluten and the dairy. I would want to see your thyroid labs that you've had done. I would wonder if they are sufficient enough for one thing, and we could start doing some iodine, start doing some selenium in there too, and your world will probably change. And I would wonder if you're doing any thyroid meds already, because if not, then we could do something like thyroid glandular, which will have 130 micrograms of T4 and roughly 30 micrograms of T3. So totally. Do all labs, beautiful. That was in the PCOS question. Friday, I'll be making sourdough bread. Oh my goodness. Beautiful stuff. The cubed guitar. Hello. Hello, cubed guitar. How we doing? Hi from the Falkland Islands. Where the hell is that? Canada? No, that's not Canada. United Kingdom? What the heck? Where are you from? Stephen Collins. This is a faithful saying and worthy of acceptance. Oh, whoa. Where did that chat go? Okay, I gotta go rapid fire through the YouTube ones because you guys are putting them in like crazy there. Okay, that Jesus Christ came into the world to save sinners, of whom I am chief. Beautiful. Amen, brother. We know the view is opposite because of the mug behind me. The mug? There's no mugs behind me. No clue what you're saying there. We know the view is opposite because of the mug behind you. There's no. What? You talking about this mug? What are we talking about? I'm so confused. Go and get blood work. You idiot. You might have gout. Go and get your uric acid level checked. Oh, okay. You guys were talking back and forth to each other. Yeah, I mean, if that's really common too. Uric acid level 69. I think that's a joke. My sugars are fine. Okay. ABU. I don't have gout. Oh man, you guys are so angry. Check your B12. Yes, definitely. I will check my B12. Oh man, you guys are coming at each other's throats in the chat. Let's chill a little bit, you know? Okay. My skin. Okay, we have an actual question now. My skin is reactive to everything. It's more reddish and darker compared to the rest of my body. Looking at my father, I think it has to do with genes. Is there a way to even it out a little bit? So for faith, faith on here, totally. What the skin shows up with is to basically represent what happens on the inside. So when people are highly inflamed, people are eating foods that they're completely allergic to from either an IgE sense or an IgG sense, you will see issues like that like crazy. There's also the GI itself. So commensal abundance, what your own bacteria are looking like, what opportunistic infections are looking like, what the mucosal membranes are looking like, and that will basically transmit to the face. Also hormonally, there can be things going on there. The darkness, the pigment thing there makes me head more toward the immune factors, but there can be a secondary hormonal issue going on at the same time. Number one thing is get your fatty acid vitamins up. So again, back to the liver glandular. Do a grass-fed and finished source of a liver organ meat there because you're going to be supplying the skin barriers with a ton of vitamin A in that good fatty acid form, and that's a fat soluble vitamin. It will build up, it will store. But email me more details about what's been going on here too. I would be avoiding gluten and wheat and soy and excess sugars and dairy and all the bad stuff, anything packaged and processed and seed oils and all that stuff. I'll be completely avoiding those things too. And you'll probably see some good results there, but getting the labs done is the next leg of things. So, totally. Okay, do you guys help with vasculitis, arthritis? If so, how? Inflammation in the blood vessels? Totally. And it's finding the sources of the inflammatory triggers because that response is happening for a reason, and your body's doing everything it can to heal things up and combat things. But when that chronic healing process the inflammatory process is a healing process. When that continues on and on and on, either you're being exposed to something or there's something internally happening that's creating that issue to constantly respond, constantly have to heal. So your antioxidants are going to be a huge factor early on for this. Things like collagen are going to be a huge factor as well, both type 1, type 2, and you can get those from bone broth and doing like a grass-fed and finished collagen as well. Um, the antioxidants are just a good cherry on top there. But another thing that I would be doing is something like Neo 40, so nitric oxide, getting that up, and maybe even go to cola in the beginning. But I would want to see blood work on you, and I would probably want to do, I would say, start with blood work and probably a food allergy test, and then we go from there. I would be curious what the GI looks like. I would be curious of a couple other things, but let's start there. And K2 rich foods as well. So your fermented dairies, your aged or fermented dairies, and natto. Natto, high K2 rich food that helps a ton with blood vessels. But again, we got to get to the bottom of why it's happening in the first place. So yes, my mom told me that I need to go back on meds. I just got off of them. Interesting. I did the AIP diet and got all types of GI problems. Interesting. And loss of appetite. So I stopped, have Hashimoto's. Okay. I would do maybe like a low FODMAP right now. I could send you some handouts and things to follow on that. And I would be getting a food allergy test done here. That would be my 2 moves for you, Miss Aruna. So send me a message. Okay. Bone broth is higher histamine than stock. Yep. It can be, um, depending on how certain people process those things, but I would say quality and for that in particular case, I was talking about a bone broth protein powder specifically. So that being a little bit different, but bone broth is great as well. It's usually when things are sitting in the fridge for a while, usually over 24, 48 hours, that's where they start to get more higher and higher histamine type of things there. But I'm not gonna tell somebody to avoid bone broth most of the time. Certain people maybe, but usually that's pretty extreme cases there. What is going on here? What am I drinking? A little bit of espresso. Antonio, I think Boo should be banned. Nah, all are welcome. Haters are welcome. Um, everybody's welcome. Freedom of speech. Okay. Sounds like these guys are fighting back and forth. What is going on? Play some music. I don't even know what that type of music is. And then Faith looks like she posted her question again. I hope you okay. Thoughts on glutathione pills? There's great ways to promote that function. Turmeric is actually probably one of the best things that you could do as far as that goes with like a singular thing, but it's not really going to be like focusing on a specific one thing that you should be taking or doing. Um, but turmeric will certainly help, and it's just about helping your liver get a few steps moving forward and to create a bunch of glutathione. But that's linked to the gallbladder, that's linked to the GI, that's linked to so many different things. Will that help the skin issue alone? Probably not. So I'll be looking for, again, covering the deficiencies there, and then looking for the immune or histamine rich reactions that are occurring, creating that skin issue in the first place. And there can be a secondary hormonal thing going on. Okay. Wait, what does nitric oxide do? So that's naturally occurring in the body and basically dilates the blood vessel. Holy crap, dilates the blood vessels like crazy. Um, which people can get a little bit deficient in, which again goes back to the microbiome, again goes back to sugar, again goes back to stress. But when all those, you're stressing out mentally, chemically, all these things, nitric oxide is going to go down. And especially if you're not taking in fatty rich fermented foods and things like that, then you're not really going to create a whole bunch. And people do need to support that. So, blood pressure, um, circulatory issues, things like that. Razia, nice to meet you. I don't know what to do with those. What kind of doctor does a TikTok live? We're just hanging out, doing good stuff for the world, helping people live better lives, which you could be for or against. Hey, not really my place to say what you need to do, right? It's up to you, man. But we can do some behavioral analysis on you guys if you want. Okay. Oh, another chiropractor pretending to be a physician. So usually that comes up when people confuse um, scopes and things. We're not talking about medications, not talking about surgery, nothing like that. So basically, food, lifestyle factors, supplementation, testing that people can do. She says, cute one. Okay. Okay, I'm going to jump back down here. Tim, it's okay, Tim. you can we could disagree. The good stuff for the world in quotes. If you're providing medical advice, well, not talking about meds, not talking about surgery, so you got your terms completely wrong here. Again, not taking shots at you, not taking shots at your identity. I'm not saying I'm better than other people. No identity shots going on here, which is famous on the internet. So that's not what we're doing on this channel. There's a time and a place for natural and medical things, but yeah, you're confusing terms. Not to mention you're providing advice. What the hell are you talking about? Without any actual assessments. Well, I talk to these people after this. They send me messages. We get on phone calls and all these things. So lacking insight into the scope of practice is glaring. All right, Tim, you're a bot, dude. You're a bot. I got freaking blue hair. So you're allowed until you cause too much disruption. Now I gotta kick you out. Look at what you did, Tim. Look at what you did. Anyways, are you an MD or a psych professional? Hell no. Okay. So, where were we? Let's do a little bit of cleanup here. Getting these. There's this Patrick guy. Patrick guy seems a little sus too. I need some moderators, to be honest with you guys. I need some moderators. What does that say? Volatility breakout. Hello, how are you? How is everybody doing? Okay, wait. Damn, amino acid. Oh, did we just get what happened in the stream? Amino acid, can you hear me, guys? Are we still live? Are they shutting us down? What's going on? Let me reload the stream here. Used. But amino acid, you make a good point. For some reason, I hope we're still live. Are we still live? I know I'm can't hear me. What? Any suggestions? Okay, Nikki says everything's good. Suzanne's saying everything's good. So it's just my computer being weird. Okay, cool. we're still alive. Let me get back to what we were talking about a little bit earlier. Okay, because I refreshed it, this is the most recent one I have. Thank you. My son has mold in his gut. Interesting. Guessing that triggered vasculitis. He has pandas strep too. So yeah, I would want to run a functional GI test on him and look at his immune panel. So innate and adaptive immune cells. So these are your CD8s, CD4s, CD19s, your B and T cells that fight all these things. So we need to make sure that they're strong enough, for one thing. Basically, get his army up to strength. But then identifying some of the rebuilding factors that we can have there, and maybe even doing a food allergy test here too. But yeah, when people or practitioners say that there's mold growing in your gut, it's typically just fungal overgrowth, not in the form of mold directly. So some practitioners say that. I'm like, no, that's not true. I mean, there's a fungal issue going on, and there can be mold, entering airborne in the system, and that can grow in the sinuses and things. But in the GI, no. But definitely fungal. Sorry to get a little bit particular there, but I'm a details guy. What can I say? What do you think about pelvic floor therapy? Love it. Love it, to be honest. It can be very great. Why did I become photosensitive to blue light after COVID? Interesting. Mm, I think you were the same person that asked about the nerve pain in the foot. So there was probably not only that sugar issue taking place, leading to B vitamin deficiencies and things like that, but also I actually had a nurse that worked with a bunch of eye doctors. I forget what her specific specialty was called, but they worked with the eyes all the time. And she saw after COVID a ton of issues with the eyes and cataracts forming very early. And I think it has a little something to do with that right there. So, not trying to get thrown off here, just saying. But that's probably why. Anyways, are there any downsides of taking CoQ10? Uh, if you're getting enough in dietarily, or having enough being created, then you're probably just peeing out a bunch of excess that you may not need. So that's really the only downside, is that if you take more than you need, you just kind of pee it out and it goes to waste. But that depends on how what your levels are out there. Can I be a moderator? I don't think we need one for YouTube just yet. But TikTok is just crazy because people are like, there's so many bots on here, so many bots, and this drives me crazy. I've said this a few times on here, but TikTok, you guys are censoring my own comments on my own videos, responding to people commenting on my videos. What the hell, dude? What the hell is that about? This is crazy. I should not be censored on my own platform. And then I write beautiful essays back to these questions that are typically a little bit sassy. So I approach them respectfully, respond in the highest level I can, putting in all my effort in this, and then it gets censored. I'm like, ah, and I basically have a couple different accounts, so I'll go on there and look if to see if that was taken down, and it just never populates, and it drives me crazy. Anyways, enough about me. Okay, love. So what's your nutrition education? I mean, got that mainly through undergrad and graduate school. No direct master's in nutrition or anything, but basically study for 2 hours a day on the human body, on foods and all different systems there and how they interact. So it kind of varies. It's not validated by all these fancy name or letters after my name, which are kind of pointless, to be honest with you guys. The more letters you have by next to your name, the less you know about things, or the more specific you know about smaller and smaller things. You know more and more about less and less. So put it that way. Hi, I've been having extreme nausea. I have an exam tomorrow. What do I do? So probably related to either some poor practice or getting sassy with your foods, Miss Noella, or the poor sleep, or the stress coming up for the exam. So we need something that you can get right now. I would go to a Whole Foods and I would get aloe vera juice from Lily of the Desert, and I would be doing 2 to 6 ounces of that at a time, and I would be doing that like every couple hours, and you'll probably feel great. Do. Okay, why did I get scrolled down to the bottom of the comment section again? Okay, yes, the nausea. Ooh, constant vomiting there. That's a little bit different there too, though. That there's not going to be like a crazy quick fix for that because it's happening for a reason, but probably stress related. So maybe order some California poppy in the meantime, and when you run into future issues like that, you'll be all set and ready to go to combat those stressors, those pesky little stressors. Hey there. 1 week I'll have had a headache for a year straight. Holy hell. That is crazy. That's probably the longest consistent headache I've ever seen. Somebody have. I mean, please send me a message on here. We'll get you a game plan going on everything to do. I'll throw in a complimentary call there in as well, if you're willing to get on the phone and talk about things. So, yeah, I mean, there can be things physically going on there to where it is a postural link or lack of activity. So, more of a sedentary lifestyle can lead to this. Or if you're a student or if you're a doom scroller, having that head down like this is going to create a whole ton of stress with muscles, ligaments, tendons, nervous system itself, all these different things. It's even been linked to issues with digestion and stress hormones and all these things. Um, so there's that piece. It can be a physical sense, or something else can coexist with that too. There can be food allergies, especially if you find yourself on the crunchy side of things, and maybe you're doing the chia seeds and the pumpkin seeds and kale shakes or blend it up and all this stuff. With some of the raw seeds and the raw veggies and things, you can have a lot of reactivity to these things. So they can be GMO, non-GMO, organic products, totally clean, but for you in particular, it may not be clean. And there's really only one way to know that because it's a delayed response and it's going to be typically tested through food allergies. So yes, Ellie, any suggestions for urticaria and histamine C to be ineffective? I would be doing some nettle leaf. I would be doing some albizia. Both of those are liquid. I would be getting a food allergy test here, and I would want to see any blood work that you have, and you may need a stool test here as well. A lot of stool test talking here. I feel like they go in phases of what we interact with here. But today's a big poop day, I guess. Um, Suzanne says, yes. Are thyroid nodules dangerous? I have three. I mean, it depends. It depends on the individual. It depends on what they look like. I would definitely be going to a medical provider and getting them looked at. If that's how you figured out that you have nodules, then you've already seen them, which is great. And just get scanned and looked at for pathology. Whether they do that through ultrasound or different techniques, that's what medicine is awesome at, is having crazy good diagnostics and imaging and all these great things. So I'll be getting them checked out. Aside from that, you should be getting a broad or very extensive thyroid panel done through blood work, and that can show us antibody levels and other things too, to do with the immune system, so that we could start to look at and throw little fishing lines into: is this a gut issue? Is this viral issue? Is this um, other microbials that can be taking place too, fungus and all these different things, or are we deficient in a lot of these things too? And you can have growths for that, or the food allergy piece. That's also another thing, but you know, you got to meet people where they're at. Me too, not too dangerous unless they're growing or your hormones are way off. Yeah, so it does depend. What's undergrad in? Athletic training, actually, through King's College over in Pennsylvania. If you had to choose one sup to detox the liver, what would that be after cutting out junk? So for guys, I'm gonna pick milk thistle. For girls, because I don't know where ferritin is at or your iron and things, I would be doing probably dandelion root is my favorite one, or Sisandra, one of those two. But it depends on the person, right? I know you asked for one, but I can't just do one. I can't just do one. B1 deficiency can cause chronic vomiting. There's all this that connection there too. Definitely, because my doc is not helping at all. Okay. Well, Cherry, we got to figure out some things out. Giorgio, do you think giving nutritional suggestions based on such minimal information or history is best practice? I mean, I've talked about food on my page for a couple years now. Um, I read textbooks on these things. I read articles on these things on a daily basis. I train on these things, study my ass off on a daily basis. And all supplements are food. And I know a shit ton about these supplements and all the pathways that they interact with, and even food and different pathways that they interact with. So all I look at is food and lifestyle at the end of the day, and then looking at labs and seeing what people need most. So I think plenty because I for 10 years now I've been learning about food and nutrition. Anyways, yeah, either way. Randy, what's going on, man? Okay, I can hear everything is fine. Oh shit. Let's go back here. I can hear everything is fine. I can hear you. Beautiful. I have solved my SIBO with oregano oil, which is good. You got to be a little bit careful with oregano, especially after long periods of time. And kefir, however, I'm finding that I'm still reacting to sugar, which is odd, but I'm only 1 month in a recovery, but the protocol resolved my allergies. So I think that there is possibly a fungal issue going on here, is still taking place, that the oregano oil can or typically will miss if you're not doing that in either the right form or the certain amount of time. So there's probably still a fungal issue going on, which would also explain the sugar history here and the nerve pain in the foot, and all connects there. So I would still go for a 3 day stool test. That would be my next move. And I'm glad that the allergies and things resolved, but when people say I cured this because I don't have these symptoms anymore, health isn't the absence of symptoms. Health is how well your body's functioning. So if we've still lost some function there, and that's under the surface here, even if you don't feel something in particular, there's totally an issue still taking place that we need to address. So yeah, do. Yeah, I was reading from TikTok. I'm bouncing back and forth here, so I can't leave you guys untouched for too long. People get mad. You guys get pretty mad if you're like, "What the hell? He's not reading my thing." Anyways, so reading TikTok, can't see them comments. Don't leave us on YouTube because TikTok sucks. I don't know. I kind of like YouTube and TikTok. TikTok is great for the algorithm, honestly. Fantastic. I find herbal teas irritating my GI lining. Okay. I don't know if that irritation is a bad thing necessarily. I would be curious of what you're doing and why. Okay. What's the best way to get rid of a panic attack? California poppy. That would be number one. Um, but also getting exercise going. And there's different light therapies as well, especially as we start to head into the colder months. But I would be fixing up your light, um, dialing in the sleep. Obviously, getting some exercise rolling has a huge effect on the brain. And in those quick moments, California poppy, like crazy. You do a teaspoon every 15 minutes if you have to. So, but send me a message, Mandy. Mm-mm-mm. Where did we leave off? The moment cold therapy, left nostril breathing, which there are some links there too. Long-term healing, tend to the gut, but there can also be connections with birth control use or the adrenals or hormonal conversions here too. But the gut's definitely going to be playing a role into here. Um, I don't know if you need to start with that type of testing because I would want to look at the adrenals first and some neurotransmitter things that are going on. But yeah, everybody's going to have a different starting point. I wonder what labs you already have, depending on some people don't have any, which is fine. Um, but yeah, for the immediate panic attacks and things, California poppy and or kava or both, um, depending on what meds you're doing right now, will vary what we do. But yeah, I would probably want to dive into things hormonally and see where that's at. Can do neurotransmitter testing and things, but I have kava tea, so you're going to need a tincture, um, like a full blown extract. And the tea, a lot of these things are not water soluble. To get all of those constituents to work on the different GABA receptors and to get the catecholamines out of the system. So the adrenaline, the noradrenaline that's building up and driving your whole freaking system crazy is like a lack of being able to get rid of those things. And then also the excitatory issues that go on with that too. So food is going to be, huge role player here. And then hormonally, things that are going on. But when I say hormonally, it can be with the brain or with some of the estrogens and female hormones there too. Black Sun Farm in Connecticut makes great tinctures. The best one I know of, because a lot of those tinctures use dried herbs. And the best way to know that is within the ratio on the back of those bottles. So I haven't found a brand aside from the Wellness Way. But Mandy, send me a message on here. I'll build out a whole thing for you. Um, so I could give you my email and things. But yeah, the Wellness Way uses fresh herbs, so directly from cut, and then start extracting, so that you're not losing those other compounds that come with that too. So just look out for that. Look out for just a wider ratio of the herbals being utilized, because typically they're going to be dried. I know it's like a super minute detail, but I love my details. So it does make a difference there. I've bought kava from several different places, but the kava from the Wellness Way, freaking that and poppy. But I would want to talk to you a little bit more, figure out what the heck's been going on here. But yeah, California poppy, kava, wellnessway.com for any of you guys. 7309. That is the patient code there. If you go to the Wellness Way website. Oh, I failed my verification. Oh, I did it again. Thank God. 7309. Let me put that in the other one too. 7309. So if you guys go to the wellnessway.com, that is basically the patient code, prioritizes your shipping and all that beautiful stuff. So, best place to get those liquid herbs or the other things that we talk about on here as well. I have an integrative doctor. Beautiful. I would want to see the labs and things that are going on there and just talk to you about things. What tests do you have to take to go to Chiro school? It's more about prerequisites than anything else. So it depends on the school that you're looking at for what prerequisites will be required. But do I do consultations? Heck yeah. I'll actually put my email in here too at the wellnessway.com. So I'm not charging for these calls right now because we're building out the clinic. So you guys got 1 to 2 months before we start charging for appointments. Take advantage. Let's spread the word like crazy. Help you guys out. And I think on this note, it's almost 8 p.m. So I should be getting some dinner in me. Honestly, I prioritized you guys over my own dinner. How crazy of me! But yeah, I put my email in there. I guess I'll put it in the TikTok one too, since there's not any psychopaths in here. Sometimes there are though. .com. But yeah, send me an email. I'll basically talk to you guys if you're in the U.S. I got a WhatsApp too, so we could talk even if you're not in the U.S. But yes, send me a message on here. I'll get you guys all the stuff that you need. What's for dinner? Actually, a bunch of peas, chicken, and sauerkraut, and a bunch of gut-friendly things. I haven't had chicken in a while too, so I'm kind of ready for it, which I never thought I would say. I am reading comments on the YouTube page as well. If you, for have you know, actually, 2 different people asked about dinner. But California poppy how? I was just talking about the Wellness Ways page to get those herbs and things from. But okay, stay away from TikTok. But the people are so nice. The people are so nice on TikTok. You're gonna get a shitstorm no matter where you go. So, anyways, send me emails, guys. Send me messages. Do what you got to do. Um, but I'm going to head out of here, and then I'll be posting things and responding to all you guys. Actually, I gotta make up a few other plans for some people that I have to send out later today and early tomorrow. So, thanks for hanging out. Stay healthy, stay free, and as always, you could be anywhere else in the world, but you're here hanging out with me. So, thanks, you guys.